I'm Dr. Willie Dan, and today I'd like to talk to you about getting parallel roots in lower incisor extraction cases with aligners. In the beginning of my career, this did happen. So I had a lot of non-tracking, poor-fitting aligners, and when I looked at the teeth, they were tipped and moved in a way that was not parallel and not the way I knew orthodontics should be. At the same time, now regularly, I can get great fitting aligners along with great parallel roots. Let me show you how I do this. Well, let's first learn from our mistakes. A mistake is an opportunity to learn how not to do it. In the beginning, I was doing very many things just like I did in braces. I would bring the teeth together with attachments in the middle of the teeth because like braces, they belong in the middle of the teeth. I put large pontics in. I would move the lower cuspid immediately behind the lateral incisor because as soon as I see space there, that cuspid should be able to rotate and correct. I would leave the pontic there all the time because I wanted the patient to have good aesthetics. And although I did place gable bends in at the beginning to move the roots, I then showed the teeth at the end of treatment parallel. Obviously, that was not working, and I might have concluded at that time, like many of my fellow professionals, is that we tried that and it doesn't work. But that is not true. So let's look at each of the challenges of this mistake so we can learn from all of them. One, I was placing attachments in the middle of the teeth, just like braces. However, the attachment on the lower right tooth is so close to the mesial surface of the lower cuspid that there's really no possible way that the aligner can go into this very sharp corner, turn around, and effectively touch the distal surface of that attachment, which is so important for parallel roots. So, the attachment really doesn't have to go on in the middle of the tooth. It can be placed more mesial on the tooth, and by placing it more mesially, at the beginning of treatment, I could have more distance away from the cuspid, and the attachment would be of great use to me. So attachments do not have to be in the middle of the tooth. They should be placed where they're most effective. The pontic. At the beginning here, we use a big pontic to give good aesthetics, and we keep that big pontic there all the way through treatment. Now you might think, well, these teeth are moving into the space, so that's not the push surface of the aligner to move the teeth into the space. That's true. However, it is a very important place for the aligner to stop these teeth from falling into this big empty space. For more information about this, I definitely point you in the direction of another video that you'll find in this subscription area, and that's called Why I Use Small Pontics. And you'll learn all about why this happens and why we want to use either small pontics or get rid of them so that the aligner can touch the teeth, although there can be problems of not using any pontic at all at the very beginning because of too much retention in undercuts. But again, I talk about that in this other video. Let's look at the problem of moving the lower right 3 and the lower left 2 as the space is created. As we move the lower right 2 away from the lower right 3, it would be advantageous to give a bigger space to the distal of the lower right tooth so that the aligner might contact the distal of the lower right tooth well, and if the pontic was smaller, it would be contacting the mesial of the lower right tooth, and this would give it great control of the lower right tooth by exposing useful surfaces. The same is true for the lower left 1. If the lower left 1 would be separated from the lower left 2, then we could also contact the distal of the lower left 1, which would help keep the root and the tooth parallel and bodily movement.